Hi everyone. Today we're going to work with a flossing the nerve stretch with nerves that run down the side of our neck through what we call the brachial plexus of the shoulder and down through the arm. We can have a lot of issues here. Carpal tunnel is a big one for a lot of us. And carpal tunnel, you can actually check to see if you have any of those symptoms by simply doing the prayer sign. It's called the Phalen's test. When you gently press your hands together and let them drop as low as you can until you feel hopefully a stretch and no discomfort or pain, but if you are feeling that kind of stress or discomfort there, normally it'll be through the top 3.5 fingers or 2.5 fingers, including the thumb, along here. Maybe you feel a little bit down the back. That's more what we call the median nerve. And we also have the reverse phalanx, where you flip the fingers upside down and you're pushing the back of the palms together and trying to bend those elbows as far down as you can, keeping the back of the wrist together. This can also produce some kind of negative effect. Usually this shows that there is some kind of carpal tunnel or nerve issue there, inflammation. I find flossing the nerve with the arm in this position really useful for everyone. So for those coming along on this journey with us today, left hand, that palm is going to push into the wall. The thumb is facing up, the fingers are pointing behind. Make sure this elbow, some people's elbows drop, try to keep it straight. Make sure the shoulder isn't shrugging. Try or aim to soften those shoulders. And what we're going to do from here is start to gently walk backwards. So as you walk back with your feet, you step back and you might find straight away the heel of the hand lifts. If it lifts, push it back into the wall. You might have to step forward again. From here, your feet are going to gently tiptoe out to the right. So as you tiptoe those toes to the right, you start to wind up this nerve, hence the flossing name. You're flossing or stretching, like flossing your teeth, through the muscle connective tissue of the arm. If you want to go a little bit deeper, start to turn your head away to the right, away from this arm. Tilt the ear away from the arm against the wall, so the other ear is to the shoulder, right ear to right shoulder. And that's going to also help to lengthen the nerves coming out of the spine, the cervical spine here at the top of the neck, through the shoulder. So you can hold this shape for quite some time, 30 seconds, a minute. It's a nerve sensation, it's not a normal muscular stretch sensation, it is different. When you're in a new shape for the first time, explore it. Maybe the head can go further, maybe the hand feels better a little higher, maybe that'll change the dynamics of the stretch. Breathe. Try to soften the body, relax. Focusing the mind on the body. Have that presence with the body, with the stretch. What I like to do is have my fingers spread or gently try to separate them more. I lean into the wall, so I put a bit more weight into the wall, and that also takes my palms wider and it stretches nerves through the fingers. To come out of the stretch, lift your head slowly back up, look towards the hand and walk around the arm. Let the body unravel and then release the fingers. And I can feel a huge release through my fingers there. Give it a shake. And just a reverse stretch, kind of a counter stretch there, more muscular, pulling that left arm across the body. Bring the right elbow up and under to support it. You hold it in place and maybe it can come higher, maybe it's more in front of the chest. I then use the muscles under this left shoulder to pull the shoulder down a few times. That's just working muscles, it's moving, manipulating the shoulder. Holding the arm firmly, I then push that left arm forward and I'm holding it with the right hand and I'm feeling the deltoids, outer deltoids of that shoulder contract. And then I soften it. Breath in and out. And release there. So if that's been a successful stretch for you, rewind the video, do the other arm, reverse it, and that's the nerve floss. Enjoy.